morning everyone and our instructor Ma'am Mary, and we are the group 3. By way of introduction, my name is Nashima Radia and we will tackle about the rheumatoid arthritis. So first of all, I like to give you an overview of rheumatoid arthritis. Rheumatoid arthritis, so a chronic autoimmune disease that affect the joint. So nangyayari in your body natural defense system or immune system that can tell difference between our own cell or foreign cells, causing yung body mo mistakenly attack normal cell. And tsaka it's a chronic autoimmune disease. When we say chronic, it's more than 6 months na, di ba? Makakakos ng inflammation around the body, which is commonly present or nakikita with pain sa atin in the joint. And the next is RA, also known as rheumatoid arthritis. Commonly, it affects sa ating mga kamay or wrist and knee, pero it can also impact any joint. Then we have unknown origin or idiopathic or unknown cause. Then, affect 1% of population worldwide. So, we have pathophysiology. When we say pathophysiology, disorder, physiological process associated with disease. In short, it refers to the study of abnormal changing in body function that are cause, consequence, or commitants, means connection of disease process. So, then I will go on highlight what I see of the main point of pathophysiology. So, primary occurs in the synovial tissue. So, nangyayari siya sa synovial tissue, keeps the articular joint well lubricate. At the same time, nagpo-provide siya ng nutrients to the articular surface. So, ang joint natin kasi needs a small amount of fluid to work. Then, the next one is phagocytosis. It's cellular process for ingesting and eliminating particle including microorganism, foreign substance. Then we have the enzymes breakdown collagen. So collagen, ang function ng collagen, nagpo-provide siya ng structural support to the extracellular space of connected tissue. Then shaking resistant to stretching, which is perfect mattress for skin, tendons, bones, and ligaments. So, if the enzyme is breakdown that collagen, it can cause edema, which is swelling, and proliferation, which is means rapid increase or growth of synovial membrane. So, we have panos. Ang panos is a type of extra growth in our joint that can cause pain, swelling, and damage our bone cartilage and other tissue, which most of them result from rheumatoid arthritis. Then, the consequence is a loss of articular surface and joint motion. And the generative of our muscle fiber is nagbabago, which leads to the tendons, our ligaments, elasticity, and contractile power is nawala. So, when we say contractile is capability.
So, good morning everyone. By the way, I am Aisa Bigogo. So, as you can see, we have two pictures of the diagram of rheumatoid arthritis, so which is healthy joint and rheumatoid arthritis or abnormal joint. So, this is the left. It is a healthy joint and we have cartilage. So, when we say cartilage, a strong, flexible, connected tissue that protect our joint and bones. So then we have meniscus is a C-shaped piece of cartilage that act as cushion between the shin bone and thigh bone. So on the next picture, which is the right rheumatoid arthritis, we have bone erosion, means weaken or loss of bone. And this part, synovial membrane are part of swollen, inflamed, and cartilage wears away or nagwi-weaken, and the joint space is reduced, which is hindi mo siya nagagalaw, for instance like motions. We have the classic symptoms of rheumatoid arthritis. Classic means usually nakikita mo. So the first one is joint pain, swelling, warmth, erythema, means redness, lack of function, and joint stiffness in the morning. So the second one, as the disease progresses, the knees, shoulders, hips, elbows, ankles, cervical spine, and temporomandibular joints are affected. So the last one, palpation of the joints reveals spongy or baggy tissue. Pattern of joint involvement, which include small joints of the hand, wrist, and feet. The second one, onset acute symptoms, bilateral and symmetric. So the third one is early stages of disease. Limitation in function can occur when there is active inflammation in the joints. Inflammation. Pattern of joint involvement, which is small joint of the hand, wrist, and feet. Second, onset acute symptoms, bilateral and symmetric. The third one, early stages of disease, limitation in function can occur when there is active inflammation in the joints. So the last one, immobilization, means hindi nagagalaw for extended periods can lead to contractures, means tightening our muscles, ligaments, creating soft tissue deformity, means swelling.
By the way, I'm Arpia Olomondot, so I'm going to discuss about my part. So, the deformities of the hand and feet are common in RA. RA is the systemic disease with multiple extra articular features, fever, weight loss, fatigue, anemia, lymph node enlargement, and Raynaud's phenomenon. So, rheumatoid nodules may be noted in patients with more advanced RA. So, ang deformities is isang parte ng katawan ng isang tao na hindi normal ang shape, gaya na lang ng hands and feet because of injury or illness. Mostly common is rheumatoid arthritis. So, rheumatoid arthritis is a systemic disease with multiple extra articular features as weight loss, fever, fatigue, anemia, lymph node enlargement, and Raynaud's phenomenon. So, note that 25% of patients develop rheumatoid nodules with advanced rheumatoid arthritis. So, ang nodule kay mag-ugoy lang siya sa people na may rheumatoid factor and often associated with rapid progress and destructive disease and other extra articular features including arthritis, neuropathy, scleritis, particulitis, splenomegaly, and Sjogren's syndrome.
Assessments and diagnostic findings. Several factors can contribute to a diagnosis of rheumatoid arthritis. Rheumatoid nodules, joint inflammation detected on palpation and laboratory findings. Rheumatoid nodules are firm lumps that can develop beneath the skin in individuals with rheumatoid arthritis. Joint inflammation detected on palpation suggests swelling and tenderness in the affected joints. Common manifestations of rheumatoid arthritis. Laboratory findings often include elevated levels of inflammatory markers like C-reactive protein and erythrocyte sedimentation rate, aiding in the diagnosis and monitoring of the condition. The history and physical examination address manifestations such as bilateral and symmetric stiffness. It refers to stiffness or limited range of motion that occurs in a symmetrical manner on both sides of the body. Tenderness, swelling, and temperature changes in the joints. The patient is also assessed for extra-articular changes like weight loss, sensory changes, lymph node enlargement, and fatigue. The ESR is significantly elevated in rheumatoid arthritis. The RBC count and C4 complement component are decreased. C-reactive protein and anti-nuclear antibody or ANA test results may also be positive. Arthrocentesis shows synovial fluid that is cloudy, milky, or dark yellow and contains numerous inflammatory components such as leukocytes and complement. X-rays show bony erosion and narrow joint spaces.
Good day everyone, my name is Angelica Setenta and I'm going to continue the report of Nurjana. Medical management, early rheumatoid arthritis. Patients with RA or rheumatoid arthritis should receive aggressive and early treatment. Treatment includes education, a balance of rest and exercise, and referral to appropriate community agencies for support. Medical management begins with therapeutic doses of salicylate or NS approved for treatment of RA or rheumatoid arthritis as several cyclooxygenase 2 or COX-2 enzyme blockers and another class of NSAIDs. Cyclooxygenase is an enzyme that is involved in the inflammatory process. COX-X medications block the enzyme involved in the inflammatory while leaving intact the enzyme involved in protecting the stomach lining. However, they are associated with increased risk of cardiovascular disease and must be used with caution. It is recommended that treatment with the DMARDs begin within 3 months of disease onset. If symptoms are aggressive, methotrexate may be considered. Methotrexate is currently the standard treatment of RA or rheumatoid arthritis. An alternative treatment approach for RA has emerged in the area of biologic therapies. Tumor necrosis factor alpha inhibitor. Example of biologic response modifiers that are currently available are additional analgesia may be prescribed for periods of extreme pain. Opioid analgesic agents are avoided because of the potential for continuing needed for the pain relief. Non-pharmacologic pain management techniques are taught.
Good day everyone, I'm Obinay Nursida and I'm going to continue the report of Miss Angelica. Medical management moderate erosive rheumatoid arthritis. So, a formal program with occupational and physical therapy is prescribed to educate the patient passing activity work simplification, range of motion, and muscle strengthening exercise. So, cyclosporine, mural, and immunosuppressants may be added to enhance the disease's modifying effect of methotrexate. So, reconstructive surgery is indicated when a pain cannot be relieved by conservative measures and treat of loss of independence in imminent surgery procedure, synovectomy, penarrowophy, arthrodesis, arthroplasty. Surgery is not performed during disease flares. So, ito yung mga surgery na hindi pwedeng i-perform habang ang sakit na yun ay sumisiklab or lumalaki. Systemic corticosteroid is yung binibigay sa patient kapag mayroon siyang unremitting implementation at sakit na nararamdaman na kailangan ng bridging or kailangan ng medication habang hinihintay yung slower DMARDs para mabigyan to take effect. Low-dose corticosteroid therapy is di-prescribe lang para sa mga short time na kailangan para i-minimize ang effect ng gamot. Medical management, advanced unremitting rheumatoid arthritis. Ang immunosuppressive agent ay pinoprescribe dahil ito ay may ability to affect sa production ng antibodies at sa cellular level. High dosage methotrexate, cyclophosphamide, acetominophen at leflunomide. Ang medisina ito ay highly toxic at maaaring mag-produce ng bone marrow suppression, anemia, gastrointestinal disturbance at rashes. Depression and sleep depression may be requires the short-term use low dosage antidepressant medication. So, nutrition therapy for the patient who is extremely unrelaxed, small, frequent feeding with increased protein supplement may be prescribed. Thank you very much and God bless.
So, I will continue our video report discussion about rheumatoid arthritis. By the way, I am Faida Dumbrang. So, the diagnosis of rheumatoid arthritis is chronic pain, impaired physical mobility, disturbed body image. Ibig sabihin, yung pasyente na may rheumatoid arthritis ay nakakaranas ng chronic pain sa kanyang ibang parte ng katawan kung saan located ang affected joint. At nagiging limitado din ang galaw nito o physical activity nito. At nag-iiba din ang itsura ng ibang parte ng katawan ng patient. Kadalasan dito is yung kanyang paa at kamay. The next, planning and rational chronic pain. Expected outcomes. Patient will verbalize relief or control of pain. Patient will be able to participate in activities and perform self-care. Patient will verbalize 2 strategies to control pain. Assess the location of the pain. So, the primary complaint of patients suffering from rheumatoid arthritis is chronic pain and stiffness of joints. Nurses can keep track of tender and swollen joints using a disease activity score calculator. Assess the effects of pain on activities and activities daily lives. Assess when the pain and stiffness occurs and if interferes with the patient's ability to perform daily lives activities, hobbies, and exercise.
Implementation and rational chronic pain. Number 1. Recommended firm mattresses and supportive pillows. Soft sagging mattresses and soft pillow prevent the maintenance of proper body alignment, placing further stress on the affected joints and preventing restful sleep. Number 2. Consider alternative therapies. Massage, acupuncture, medication, and more can help reduce cortisol levels, the stress hormone which in turn reduce inflammation. Number 3, recommend warm, moist heat. Heat promotes muscle relaxation and mobility, decreases pain, and relieves morning stiffness. Provide sustained heat to reduce pain and improve the rhythm of affected joints. 4. Administer in medication appropriately. NSAIDs are given to reduce inflammation and ease pain. Number 5. Ensure adherence to MARD are used to treat RA and slow disease progression. Planning and rationally impaired physical mobility. Expected outcomes. Patients maintain or increase the strength and function of the affected joints. Patient will participate in recommended physical therapy. Patient will maintain joint function in the absence of contractures. Assess, monitor the degree of joint inflammation. The activity or exercise level depends on the inflammatory process's progression or resolution A. Evaluate the patient's ability to perform adults safely and effectively. Safely with ambulation and self-care is priority. Assist rhythm of joints and provides baseline data and monitoring of the effectiveness of the planned care. That's all. Thank you.
So, good day, ma'am. This is my assigned topic, and by the way, I am Darangina Mu'mina. So, planning and rational disturb body image. So, body image disturbance, this is defined as a distorted perception of how someone sees their own beauty. So, paano ba natin malalaman kung ang isang tao ay merong body image disturbance? So, if ever a person is very upset emotionally and often needs special care or treatment. So, next kay expect outcomes. First, kay patients will verbalize acceptance of joints deformities. The second one is patient will formulate realistic plans for the future. And the last one is patient will demonstrate positive lifestyle change. So, next kay note withdrawn behavior, denial or over concern with body change. So these behaviors may suggest emotional exhaustion or maladaptive coping methods requiring more in-depth intervention or psychological support. And then the next guy assess the patient views themselves and their usual lifestyle functionality. So this is identifying on how the illness affects their self perception and interaction with others will determine the need for further intervention and counseling. So that's all for my part po, ma'am.
So, good day everyone. I am Aslia Macalinog. So, let's talk about the 6 implementation and rationale distort body image. So, the first one is encourage verbalization of concern about the disease process and future expectation. So, listening to the patient's concern regarding their experience with the illness and what they expect to happen in the future will provide an opportunity to the identify fears and misconceptions so that they may be addressed opportunely. So the second is acknowledge their feelings or grief, anger, or loss. So constant pain is wearing and feeling or anger, irritability, and resentment are common. So the third is involve the patients in planning their care and in scheduling their activities. So involving the patients in the treatment process will enhance feeling of competency and self-worth, encouraging independence and participation in therapy. So the fourth one is give positive reinforcement for accomplishment. So providing positive feedback will allow the patients to feel good about themselves. So the fifth is refer to counseling or support group as needed. So counseling may be needed for ongoing support to deal with any feelings of loss or difficulty combined with a chronic disease. So the last one is recommend treatment for RA nodules. So RA nodule usually aren't painful but may be source of embarrassment for the patients. So that's all. Thank you.